Does your face feel like a balloon that is about to pop? You know that feeling. The pressure behind your eyes, the throbbing in your cheeks, and a nose so stuffed you feel like you're trying to breathe through a coffee stirrer. If you've tried sprays, steams, and meds and you still can't breathe, you are not alone. Most people think a stuffy nose is just mucus, but it's actually inflamed tissue. To fix it, we can't just treat the symptoms. We have to hack the body's electrical system. In this video, I'm going to show you a powerful 60-second technique that targets the root of the problem. We are going to stimulate a specific cranial nerve, the trigeminal nerve, and manipulate a small bone inside your skull called the vomer bone. It sounds technical, but it is incredibly simple, safe, and works almost instantly to open up your airways and drain that pressure. The science, simplified for retention. Before we get to the technique, you need to understand why this works so you can do it correctly. Your face is filled with hollow cavities called sinuses. When you get sick or have allergies, the lining of these cavities swells up, trapping fluid. This blocks your eustachian tubes, those little tubes connecting your nose to your ears, which is why your ears feel popped or full when you're congested. The method we are using today hits two birds with one stone. First, we physically shift the facial structure to create space. Second, and this is the secret sauce, we trigger a neurological reflex. We are sending a signal through the trigeminal nerve, the massive nerve responsible for sensation in your face, telling your brain to constrict those swollen blood vessels and release the floodgates. Part 1. The vomer bone toggle. Let's jump into the first phase. The vomer bone. Toggle. The vomer is a thin, flat bone that runs vertically right down the center of your nasal cavity. We are going to gently mobilize this bone to create room for drainage. Here is exactly how to do it. Take your tongue and push it flat against the roof of your mouth. I want you to push hard. You are aiming for the hard palate, right in the center. While you are maintaining that upward pressure with your tongue, take your two thumbs. Place them right underneath your cheekbones, close to your nose. Now, apply firm pressure inward and then push outward towards your ears. Imagine you are trying to fan your cheekbones apart. So you have two forces working here. Your tongue pushing up on the vomer bone and your thumbs spreading the maxilla, your upper jaw bone. Hold this for about 15 to 20 seconds. Keep breathing. What you are doing is mechanically opening the nasal suture. Many people feel a sudden pop or a shift in pressure immediately. You are literally making room for the fluid to move. Part 2, the trigeminal reset, the neural trigger. Now that we've created space, we need to activate the drainage. This is the part that most people miss, and it involves the sneeze reflex. It sounds funny, but sneezing is your body's natural reboot command for your nasal passages. It forces air out at high speed and resets the cilia, the tiny hairs in your nose. For this, grab a clean tissue. Roll one corner of it until it's a tiny, thin point. You are going to gently insert this into one nostril. Aim for the inner wall of the nose, not the center. We want to tickle the sensory fibers of the trigeminal nerve located right along that nasal lining. Move it back and forth gently. You will feel a tickle that creates an urge to sneeze. Don't fight it. Let it happen. That sneeze is a powerful contraction that forces the eustachian tubes to snap open and creates a vacuum effect that pulls fluid out of the sinus cavities. You can do this on both sides. Once you sneeze, you will likely feel an immediate rush of fluid. This is a good thing. It means the blockages are breaking down. Why this combination works. When you combine the mechanical spreading of the cheekbones with the neurological reset of the sneeze reflex, you are attacking the congestion from both the structural and electrical angles. You aren't just blowing your nose. You are forcing the body to evacuate the inflammation. This also helps equalize pressure in the ears. So if you've been dealing with that muffled hearing sensation, this is often the fix. Conclusion and best practices. You can repeat the pressure point technique, the tongue and thumb press, multiple times a day. It's completely drug-free and safe. The sneeze trigger is great for those moments when you are completely blocked up and nothing else is moving the needle. Give this a try right now and pay attention to how your breathing changes. Do you feel that cool air hitting the back of your throat again? That is the feeling of relief. If this technique helped you breathe easier, do me a favor. Hit that like button so this video can reach more people struggling with sinus pain. And comment below. Did you feel the drainage immediately or did it take a few minutes? I want to hear your experience. Thanks for watching, and here's to breathing clearly again. I'll see you in the next video.